Welcome to Truth, Money, and Freedom. Today is Monday, the 11th of November, 2019. I have a special treat for you, gang. I have with me today Conjecture and ChaosCraig, and we're going to do a slightly different podcast. Conjecture's taking the lead on this one. We're going to be talking about the American healthcare system. So, Conjecture, take it away. And once again, welcome to both you guys.
Hey, Denny.
Yep, hello. And, well, today I thought we'd do something different. Normally we like to do a bunch of these short little podcasts. Relatively short. You get what I mean. Timmy will put out a bunch of them about the news cycle and everything else. However, I have a topic that I've been talking to Timmy for well over a year now about doing. And I've put together well over a couple hundred hours of research, and Timmy has put in his own research too. I mean, he's read the Obamacare bill, which kind of tips our hand of what the episode's going to be about. We were wanting to do a multi-part series on healthcare and why U.S. healthcare is how it is, and why you may hear these claims that socialized medicine is better when it's clearly not, and, why your Facebook friends are wrong about healthcare.
What? You mean all those memes you find on the internet are wrong about healthcare?
Yeah, you get the idea.
Yeah, I do.
It's, after this, you should be able to describe to your friends, between what we talk about and my sources, about why healthcare in the United States is so expensive, yet it is so high quality, and how these lefties news sources misrepresent U.S. healthcare.
Okay, gotcha. I'm going to point out something real quick, Conjecture. For everyone listening, I got a bunch of links that will be in the description section below. So if you click on Show More on the description section, you'll find links to everything that we're showing in this podcast. Okay, I'm sorry about that. Go ahead, Conjecture.
Yeah. We're going to see how this podcast goes, and if it goes well, we'll continue the series. Okay. The first one is, it's about the World Health Organization, right? So it's this international organization that talks about healthcare. And as you've seen, if you've been in a sociology class or a psychology class or any social science class in college in the last 10 years, your probably socialist, maybe Marxist teacher has brought up that the World Healthcare Organization puts us below Cuba in our healthcare quality. What they don't tell you is that this 214-page document by the World Health Organization was actually done so badly they have never repeated it.
Okay, it never repeated the study?
Yeah, they never repeated the study.
Okay,
it was
that's
done
not
so badly, and there were so many problems with it.
Gotcha. And so that's not true science then, because they haven't been able to, basically replicate the same information from another study.
Yep. If you've ever watched Adam Ruins Everything, and he's kind of a lefty guy, and he actually referenced the World Healthcare Organization study, and he doesn't point out all the problems they've had. It is actually quite ridiculous. And above it, I have this Mises article that I gave to Timmy to pull up in front of everyone.
Okay, which the Mises report and American life expectancy?
Yeah.
I got it.
Yes. Yeah, I mean, it goes out and it talks about these different factors and why Americans live shorter lives than people in other countries. They talk about, one of them is, the numerous factors revolving around how long we live is smoking, our physical environment, physical activity levels, opiates, obesity. And if you've ever listened to Ben Shapiro, he tells you from his sources, and he has sort of a fair bit of them, that you don't even have to adjust for all of those factors to show why in the United States we live longer, or we live longer adjusting for only two factors than any other country in the world. And those two factors are the number of miles driven and obesity. Adjust for just those two, we live longer than anyone anywhere else in the world. adjust for more, and the margins by how much in the United States we live longer than other people in the world grows greatly.
Okay, understood.
As you can see, there's all these graphs here, like the annual percentage, of kilometers driven per capita. And in that graph, we are clearly above everyone.
We sure are.
No country even hits our averages, but it's also because we're that much bigger of a country than every other country on that list. We are that much more spread out.
Mm-hmm.
You scroll down, you see that in the United States we're actually much less active on average. Like how much we travel, walking, and cycling, we average less than everyone else everywhere else in the world, at least that were mentioned on the graph.
Mm-hmm.
The number of passenger cars, we're well above everyone. Just, we drive that much, or, henceforth, it's why our road traffic death rate per 100,000 is so much higher than everyone else.
Well, the obesity epidemic is something that could be linked back to healthcare, because I was watching this documentary called What in the Health, and it kind of goes into the details about how meat packaging companies and various food companies are in bed with the health organizations. So there's also a component of corruption there.
Yeah. If you've ever looked up the 10th Amendment Center, and they talk about the FDA, right, and how the FDA bans us, from getting access to more local food, which, tends to be better for us because, the smaller the organization, the less likely it is they're going to be those giant chem farmers. And I just posted an article to the 10th Amendment Center to build off of what Craig was just talking about.
In the chat?
Yes.
All right, gotcha. All right, yep, I sure can. Okay, the food report.
It talks about, with the FDA regulations and all these other laws that were passed, the great consolidation of all of our food industries. I think we're only down to a handful of what we used to be at in terms of food processing centers in the United States. They've consolidated so greatly.
Well, logistically, that's not a good idea to begin with anyway, for distribution purposes, is it?
No. Craig, do you want to say something?
Yeah, the government regulations foster monopolies.
Yes. Agreed. Even in food, medicine, anything.
Yeah. It goes even a little beyond that, is because when you consolidate all of this food processing, you also consolidate the places where illness can be. If illness breaks out in one food processing plant when we have thousands, it only affects that one and the food distributed there. But when you're down to a handful, I think we're less than 50 right now, the one outbreak affects a much greater portion of the population because there are that fewer distribution taps.
Okay.
Yeah. I'm sure there's some sort of quality control and quality. But, maybe they don't find everything every time, sure.
No, evidenced by, of course, salmonella, coming in vegetables, no less. There are issues, within the system. But mostly, I believe, conjecture, I'm sorry for butting in, mostly I think it's from vegetables coming from Mexico. I think at least that's the way it was 10 years ago. And I hate to be crude, and I'm not trying to be crude, but that was because the stories were coming out at the time that they were irrigating with raw sewage. And so that's why they had such a big problem with salmonella in vegetables coming from Mexico.
Oh. Well, the problem that we have with a lot of this stuff is that healthcare, it comes from our environment. So when you have poor food coming in, you're going to get poor health results.
Right.
But, there's even more to it. just as I told you, just accounting for two factors. Socialized medicine is so bad when you remove two things that the healthcare system has very little to do with: obesity and number of miles driven. Socialized medicine falls off a cliff in how it performs in the world. And with some of the links I've posted, you can go through them. There's Tom Woods. He's a really good libertarian on this stuff. And he had a guest on from Sweden. I think it was from Sweden. And apparently Swedish people used to live longer, 4 years longer, before they had socialized medicine.
Yep.
You know, the funny thing about it is with socialized medicine is that the government can't actually allocate resources very efficiently.
That's correct.
So in places like Canada, you end up with these really long waiting lists. As if you've ever listened to, I think his name is Stefan Molyneux, just to get in to see somebody to find out that he had cancer, it was scheduled 6 months out. Right? And then the operation was scheduled 6 months out after they found out he had cancer. So what he did is he just scheduled an appointment in the United States, and he was in surgery within 2 weeks. I mean, it's these huge gaps in how long it takes you to get health care when everything's free versus when everything is paid, that you get these really huge and dramatic results. Like you look at our cancer survival rates. Number 1 in the world is the United States.
Right, and I do want to say something. Socialized healthcare is not free. You know,
it is by no means free. You know, anything there's nothing more expensive than something the government gives you for free.
That's right.
Yeah, there's an easy pattern. Anything the government touches, the quality goes down, the price goes up.
Yep.
And the healthcare today costs a lot more than it used to.
Yeah.
Let me go ahead, Craig. I'm sorry.
The higher the price will go, and the lower the quality will go.
Okay, I hope I'm not gonna take us off on a tangent here, but what about the incentives for people to go to medical school? For instance, in the system we have here in America, a huge factor is how much money doctors make. So how would that be affected in the socialized system, Conjecture?
Actually, professionals are specialists are one of the highest taxed professionals in the country.
Okay.
So the incentive for becoming doctors are becoming less.
Okay, so they still make the money. It's just they're taxed at a higher rate. Is that correct?
Right. They're taxed very heavily, and also the education costs a lot more.
Right. I got that part.
So you know the margin, the marginal gain starts to vanish. And that's why there's a shortage of new doctors entering schools.
Yeah, and when you look at this up, and I also have a video on here, basically it covers briefly why healthcare is so expensive here, and it sort of begins its origins, and I think it was around the 1920s, when the American Medical Association, and basically a bunch of doctors lobbied to get the American Medical Association to be the exclusive monopoly on healthcare. And they started pushing the machine model, as some people called it, of healthcare. The model is essentially you kind of treat people like robots. You know, you have a problem, so we give you this drug to treat you, and that fixes the problem. And the idea was they were going to get rid of the quacks, as they called them. You know, the crazy people they didn't think deserved to be in the healthcare industry, right? So they sort of waged a war on alternative medicine, which, funnily enough, has had the opposite effect. When they started waging the war on alternative medicine, they increased the amount of alternative medicine because now they're all getting licensing boards. Like you have chiropractors, you have other sort of homeopathic medicine people like acupuncturists. They're now around in even greater numbers due to their efforts to try to kill them. You know, it's anything the government goes to war on, you get more of it. The war on terror, now we have entire countries that are just full of terrorists. You know, you have the war on drugs. Now we have the biggest opioid epidemic or drug epidemic ever. We had the war on What is it? What's the other wars, Timmy?
Poverty.
Yeah, the war on poverty. If you've looked up this one recently, you pull it up on Mises.org and other websites.
Well, I will
They
bring up another
originally,
one too, is a war on illiteracy. And I can think of a lot more conjecture, but I'm going to stop there.
yeah. Well, we should probably stop anyways because we'll be going off on a tangent. But everything the government goes to war with, you get more of.
Yep,
I'm
agreed.
just going to cite this one shortly. Lyndon Johnson signed in welfare. You can look at poverty, and you can look at it. It was on this downward trend. Lyndon Johnson signs in welfare in the 60s. It finally gets put together and well-funded in the 70s, and poverty stops dropping, and then within a few years it starts going up. And with all these socialized programs, they always have to lie to you about the numbers because they're so ideologically driven that they can't accept a failure, that they have to rig the numbers to make it look good. But if it was so great, they wouldn't have to rig the numbers to make it look better.
I agree. We see that throughout the entire financial system too.
I'm going to go back because we're getting off track about why healthcare is so expensive. So their war on alternative medicine created the American Medical Association, and all it did was actually restrict the amount of formal medicine you have, right? So before they wanted to get rid of the doctors who thought that diet and exercise was one of the keys to living longer. Now it's become a focus of medicine, but before that was one of the things they wanted to eliminate because, somehow that couldn't possibly have a lot to do with your health. The next intervention they did, which screwed up our system further, is what the doctor lobbies did during the Great Depression. During the Great Depression, we had insurance, right? And then medical insurance was disaster insurance, and it was really, really cheap and still affordable despite the American Medical Association. Before I go any further, the American Medical Association was also created with racist intentions. So all the schools where if a minority school, like if you were black or something else, and you weren't a majority white school, they discriminated against you by not giving you licensing. It was really racist. As with a lot of these socialized programs, they are essentially they cause systemic racism, despite the fact that the people who advocate for them try to tell you the opposite.
There's also an point there for corporate cronies.
Yeah.
The next. Yeah, so the corporate cronies, they get to these medical associations, and then medical associations get to decide who's a quack, who's not a quack, and the ones who are not a quack are the people who sell the products for their clients. Right?
Pretty much. So the next intervention came in during the Great Depression. During this point, the doctors' unions the doctors were sick of getting paid in barter, as in the people were so poor after the destruction, or I should say the implosion of the financial system with all those banks collapsing, that people no longer had very much money. So they were doing things like trading chickens and eggs to doctors to get healthcare treatment. So what the American Medical Association did, or not them, sorry, just doctors' unions, but I believe they were included, lobbied the government to make it so that insurance had to cover maintenance checks with your doctor rather than strictly being disaster insurance. So every time you would go to the doctor, they had to pick up the tab, right? It would be like how expensive car insurance would be if it had to cover the oil and windshield wiper or windshield wiper fluids and airing up your tires. It would get really, really expensive because as these maintenance operations to your car started being covered by these insurance agencies, they have to push up the price for things that you should be paying for out of your own pocket.
Now, for those of us who wanted to save money and pay for things out of pocket, can no longer afford them.
Yeah, because now, these big bureaucracies and these insurance companies, they're really bad at negotiating. It comes down to the calculation problem and why socialism will always fail. And it's just because in a big organization, it's hard to know what's going on at the ground level. Another interesting bit here is So that didn't completely destroy the healthcare system yet. It was the next intervention that came much later, and it was due to an epidemic in the United Kingdom and Europe. So do you guys remember that drug that was introduced that was supposed to help women with morning sickness?
No, I sure don't.
Well, it was this drug that was causing all of these birth defects. It was in Europe and the UK, and it was causing all these problems. And the government came in, or actually it was a politician. He wanted to strengthen the United States requirements, the FDA, by increasing our standards and making them more rigorous in order to prevent drugs that were harmful like that from ever making it into our system, right? So originally the FDA approved any drug that they deemed was not harmful to people's health. And you would go through a very simple process. I believe it was only like $1 million or so to get the drug through, which is still outrageously expensive. And then you would get your drug through the FDA. And the other problems that this guy was citing, and some of them were legitimate problems, but I'll get back to that, is that some of these generic drugs, which were being used to substitute for these name brand drugs, weren't quite as effective. It was due to little things like the particle size in these drugs. Like if you make the particles too thick, maybe it doesn't get through your stomach without being dissolved. Or, if you make them too thick or too thin, it'll have these weird little interactions with your body. So you could get the same drug through and you'd end up with these problems. So they decided they would implement a 5 sigma standard, which means, I believe it was 10 million to 1 odds that your drug was not only safe but effective against whatever it was you said it was going to be treating for. So you might think, well, maybe that's a good thing that the government should say that if you're going to advertise for a drug that it should work the way you say it does. But the problem is, now it costs $1 billion to get a drug through on average, right? They had multiplied the cost 1,000 times on their war against unsafe drugs. And now the only drugs you see coming out of these companies, you're no longer seeing antibiotics like penicillin. They have lots of antibiotics sitting on the shelves. Not too long ago, I even read about an antibiotic that was derived from blueberries that they cannot get through the FDA because it's so outrageously expensive to how much the payoff will be if they get it approved.
Yep.
And then once you get that drug through the process of over $1 billion, you now have to pay licensing fees, which can be millions of dollars every single year. And if it's something like antibiotics, go on.
Just extortion, really.
Yeah. Have you ever wondered why cancer treatments are so expensive? It's not because they're difficult to develop. It's that they're too expensive to get through the FDA, and they treat such a niche condition. Of course, it's not quite as niche as some conditions, but it is niche relative to high cholesterol drugs.
You're financing bureaucracy just to, buy some medicine.
Yeah, or even drugs that treat ED.
Service. Yeah.
Even for drugs that treat ED, like people, buy more Viagra and they buy more Cialis and they buy more of those drugs, and they'll ever buy of maybe a drug that treats Huntington's disease, because Huntington's disease affects almost no one.
Mm-hmm.
Or maybe a disease in like multiple sclerosis, because that's a disease that affects very few people. And I'm not saying almost no one, as in no one really suffers from this. It's that not enough people suffer from it in order to justify the cost of putting the drug through the FDA.
Mm-hmm.
As a matter of fact, one company a while ago published well over 10,000 different chemicals that they have found were proven effective against the most deadly disease in all of mankind, believed to have killed half of everyone who has ever lived, malaria. So they have 10,000 substances to treat malaria. If they were to try to put that through the FDA, it would cost half of all of the money in the United States economy for a given year. So expensive, in fact, you would destroy the U.S. economy trying to get them approved. Or just test them, because that's not what's going on in the FDA. Go on.
It would take like a fraction out of the GDP.
It would take half of the GDP. Not a fraction, half of it. And that's just, just to get it approved, or not approved, I mean tested, right? So you can have all these drugs that you think are probably safe, but you aren't 100% sure. And not only do they have to be safe, because they all could be safe, but if they don't work to a point which is provable at 10 million to 1 odds, they are not getting through the FDA. All these drugs that are being kept off the market that could be saving literally billions of lives every year. Yes, I say billions because of how many people are affected.
Well, I don't know the current
malaria.
stats, Conjecture, but I think it's something like 30% effective towards what they're working towards is considered just a hands down success. A marginal, it's
Yeah.
30%. It might even be lower than that. So they're selling these drugs that cost, a lot of money because the government's got their, fingers in the pie there through the FDA. And 70% of the people who take the drugs potentially could get absolutely no benefit, even though they're paying an exorbitantly large quantity of cash to be on that medication.
Yeah. Well, that's the thing about these drugs, is when you have so few of them, you have all these different people who have all these different metabolisms and different things and quirks with their biology that if we just had 100 more drugs, you could just go down the list until you found one that worked for you. But we can't have that because it costs too much money. And, originally, this one wasn't really started by Big Pharma. It was actually started by a politician who thought that, he was doing the right moral thing by increasing the regulations on drugs. However, as you know, there's this thing called regulatory capture, in which Big Pharma, or big industry, is able to get their hands around the regulatory agencies, and they're able to kill their competition.
Mm-hmm.
Big Pharma loves these new regulations.
They do.
Because now it may cost them $1 billion to get a drug approved, and they have to pay millions of dollars every year, but it kills all their competition.
Mm-hmm.
Okay. However, that is another thing we haven't quite gotten to. We have another reason why healthcare is even more expensive.
Okay.
I kind of got off topic from it, but it's related to the first two items we were talking about. And that was during World War II. So now you know that we restricted the amount of doctors they can get in through the AMA. And now we're to the point in this story, from the first two, that we have also said that health insurance must cover everything. Now, during World War II, the government made it illegal for people to get pay raises, right? So we still had inflation, and people were still wanting more money, because prices are going up and everything else.
Mm-hmm.
But they weren't allowed to get paid more money. So businesses, in order to be able to pay their employees more, had to go through the government and get a special tax exemption passed so that they could pay for their employees' health care
Mm-hmm.
in order to incentivize more of them coming to work for them. Now, here is where this got worse. So before, because bureaucracies are very difficult or very bad at negotiating on the ground level, and that's why healthcare prices have increased because of insurance. Now the cost of insurance has increased because you have another layer of bureaucracy between you and your healthcare. How does your employer know what a good healthcare plan is? Is a high deductible good or is a low deductible good? Well, high deductible is really good if you don't want to pay a lot of money for your insurance.
The insurance salesperson tells the HR person what's a good package. That's how it works. Trust me.
Yeah. Right? So they try to sell them on all these low deductible plans that they can charge them a fortune for.
Correct.
And then, they cover dental, which is basically useless. I believe Timmy was telling me that he pays less to his dentist out of pocket than he would pay out of pocket if he used his insurance.
That is correct.
Right? And you end up with all these quirks because you now have two levels of bureaucracy between you and your doctor. Before, you would pay your doctor directly, and then when you get hit with something catastrophic, your insurance would cover it.
Mm-hmm.
But now we've gotten to the point where people associate their work with healthcare
Mm-hmm.
because the government will not reverse this 1940s policy of giving your work the tax exemption for your healthcare when it should be you that gets the tax exemption for your healthcare. And then you could pick the plan that works for you. When people in the market are allowed to pay for things They want they want the highest quality thing they can get at the lowest possible cost. That's how costs are controlled in the free market. It's the incentive. It may not always be true in every case, but it is true in the aggregate. Now, that sort of brings us up to our modern day. And this is where healthcare gets even more expensive.
Yep, I was about to bring up the Obamacare
implementation-
aspect, but you go ahead, Conjecture.
So I've gone through the 3 interventions that happened before the FDA, American Medical Association, the doctors' unions lobbying insurance to cover everything, the government lobbying, or not the government, but businesses lobbying the government to give them tax deductions on insurance. And then 4th, the FDA that increased the price of drugs greatly. Now, Timmy is going to go on how Obamacare did things
Okay.
to make the problem worse.
Yep. Everything Conjecture said, this is on top of all of that. When the first bank bailout bill happened, and yes, I do mean the first bank bailout bill, when that happened in 2008, it was a $700 billion bailout for the banks. But there was actually a rider in that bill. It was one paragraph. And it did say that if the government should ever take over healthcare, it has the right to ration healthcare. So basically what they built into this bill was the ability for the government to actually create, I don't know if I want to put it this way, but artificial scarcity. Now, I know that sounds kind of interesting when it comes to, first of all, putting something about healthcare into a bank bailout bill doesn't make sense anyway. Sarah Palin brought this up, and she was crucified by the press for even talking about it. But it is true. It's in the bill. And what that means basically is that when the government gets to a single payer system, or even before with Obamacare, when they're actually managing and mandating how healthcare is provided to the insurance companies, with elderly people, they're being refused services. So for instance, if you reach a certain age, on Medicare, you can't get knee surgery anymore. There's a cutoff. Equally, if you need a new hip, there is a cutoff age for that as well. So basically, that's the beginning of euthanasia. It's the beginning. It's not euthanasia, but just denying people, the health care. So basically with that, coupled with the increased costs to employment, as Conjecture was talking before, through Obamacare, by increasing the profits to insurance companies, guaranteed profits, written right into the Obamacare bill. So I'll use my wife as an example. She works at a major U.S. retailer. And since Obamacare was implemented, the cost of the premiums that come out of her check have literally almost tripled, about 2.5 times more than they were before 2010. And to make matters worse, what we have to pay to go to the doctor has also increased, even though we've kept the same plan. So they've got us on both sides. They got us for the premiums, and they get us for the copays. And then not to mention the copays went up for prescriptions as well. So this was all built into the Obamacare system. I'm not going to get into other aspects of it because I don't think it's appropriate for this podcast, other reasons why they created Obamacare. But one of them was to actually fleece the middle class. This is a fact. Now, if someone can come up and show me proof, hey, TC, they didn't do it for this reason, they did it for these reasons. Well, that's certainly what it's accomplishing, though. The middle class are really they're hurting right now. And one of the big, what's that, Craig?
What middle class?
Yeah. So, yep, they're screwing them. And they want everything. They want everything the middle class owns. And part of that is Obamacare, which is part of, basically what they're doing with healthcare. So it's just raising the prices. Go ahead, Conjecture.
If you look into it a little bit about the Obamacare thing, you can get some people who claim to be on the writing team. They told you what the objective, or they went out and said what they what the objective of Obamacare was. And that was to make healthcare so expensive in the private sector
Mm-hmm.
that people would be begging for a
For
single.
single payer system, correct. Yep. And that's what it's doing. So basically, you have to go after the middle class for that. So, but at any rate, that is the long and short of Obamacare. We can talk about more aspects of Obamacare in a
lot of these
subsequent program.
left-leaning. Yeah, that's the funny thing about a lot of these left politicians. They only add economics when it's beneficial to them.
Yeah.
I believe you have more you want to say about Obamacare too?
No, I prefer not to in this particular podcast. But
Okay.
it will go into more politics and also just morality. But we can cover that in another. Go ahead, Craig.
Still hasn't been repealed, so there's nothing more permanent than a government program.
Yeah, there's nothing more permanent than a government program. That's right. Try and stop.
Yep.
One way. It's only moving one way.
Yep.
That's it.
Yep. So, but
Reasons are the economics of why Obamacare is so bad, or is increased healthcare costs so greatly, is because what they've done is they've added mountains of paperwork to doctors' loads. Right? So they may see you for a 15-minute doctor visit, but I believe the figure was for every 15 minutes they see you, they have 30 minutes of paperwork.
Mm-hmm. Yep.
And that was one cost they added. And I know people who work in medical billing, and they've told me what the healthcare codes were before, because the government standardized these healthcare codes. If you use insurance, you have to use these healthcare codes. And it went from, I think it was 20,000 or something like that, and they took it all the way up to well over 100,000 codes. It is so pedantic that there is a distinction between you breaking your finger by, or injuring your finger through one incident, like if you injure your finger while you're on a ski-doo, and it is really specific, like if you're on a motorized aquatic vehicle versus if you have a needle through your finger. Not joking, those are two separate healthcare codes. There are so many of them that doctors, as you can even observe this, are en masse, according to my doctor, all going to hospitals because they can help them with all this paperwork, because you can have all this specialized computer software that takes your patient's chart and puts it into all of this paperwork, and it makes finding all these codes easier. And that software is ridiculously expensive for whatever reason. And to top things off, you have other trends. So now it requires these mountains of paperwork. And on top of that, the other problems that it caused is because you can no longer, insurance can no longer exclude you for having a pre-existing condition, right? So if you were allowed to have health insurance outside of your work and you got the tax deduction for it, so you wouldn't be penalized on your taxes, one of the things you'd be able to do is keep your healthcare plan no matter where you went, right? And every time you get a new job now, you have to get a new healthcare plan. And the problem with Obamacare is they decided they would treat the symptom rather than the root cause. So now healthcare companies are now no longer allowed to exclude you for pre-existing conditions. Well, you can see very easily how that gets abused. What's the point of paying for disaster insurance when you can just wait till you get cancer to buy healthcare insurance, or to buy health insurance? And that's one reason why the costs explode. And that's why originally, and this is what I said, the left understands economics when it's convenient. They put in a little condition in the Obamacare that says that you are forced to buy health care, otherwise you get fined. The problem is, they didn't put the fine high enough to get people to buy health care before they get cancer. And it was later determined that that one rule was unconstitutional. Because it is. You can't force people to buy a product.
Yeah, but look at the flip side of that conjecture for a second. Whereas you may have cancer and, you haven't had insurance for, 30 years, you go in and now you can get insurance, and then they're dealing with your cancer. But look at that for the elderly when they're on Medicare, or in other words, a single payer system. Let's call that a single payer system for lack of a better term right now. Once they're on Medicare, you need a new knee, you need, a hip replacement, or you have very serious back problems, you're screwed. what they'll do is they'll give you pain meds. They won't, take care of the problem. So it is interesting, the dichotomy there.
Yeah. Well, what the screwed up part about the Medicare system is the fact that because of all these other government interventions, they've inflated the costs of healthcare greatly. As a matter of fact, they've inflated the cost of healthcare so greatly with all these government interventions that the United States per capita spends more on Medicare and Medicaid than any country with socialized medicine spends on their socialized medical programs per capita. No country spends more than the United States.
Mm-hmm.
And our Medicare and Medicaid doesn't even cover everybody, and it's that expensive.
Yep, and it's also one of the unfunded liabilities that's absolutely impossible for us to keep on top of. We're going to have to default on that one.
Oh, eventually, because it's going to eat the government budget.
Mm-hmm.
They have all these regulations in here to benefit all these special interests. They refuse to get rid of any of them, and all they want to do is treat the symptoms. You know what I mean? It's like putting a Band-Aid on gangrene.
Yeah.
Before, if you would have just cleaned out the wound, that would have been that. But they're just going to stick Band-Aids over it and wrap it and paint your leg until they have to cut the thing off, rather than actually treat the symptom.
Correct.
Or, I mean, not treat the symptom, but...
Yeah, I got what you meant.
And here's the thing. If you would have gotten cancer, and it wasn't for this FDA regulation, getting treatment probably wouldn't have cost you more than $30,000 for your entire cancer treatment.
Yep.
And as a matter of fact, that would be a highball figure, because you'd have more doctors, more drugs, more everything. As a matter of fact, we may have come up with a lot of cures to a lot of these things. I mean, you can pull it up in the news about CRISPR-Cas, that you can take these protein shells and you can fill it with CRISPR-Cas, and if you have cancer in your DNA, they can inject it, target the cells that would be subject to that cancer, and replace the gene that causes cancer and fix it. But, is that treatment ever going to get through the FDA? I sincerely doubt it when it costs $1 billion. And if they do get through the FDA, it's only going to be because one person gets CRISPR-Cas through, and then everyone else follows, because they have these really strange regulations that once you've paid them a bunch of money to get a drug through, you can get similar drugs through. But the thing, under less scrutiny, which is really strange, because you would think that the FDA, if they're holding these really high standards, they're only holding these really high standards for getting one type of drug through, and then the rest of the things that follow can get through much cheaper, which creates this huge perverse incentive, because you can get unsafe drugs through that, even if they were to follow different regulations, or I should say the drugs that would have naturally failed the free market test, get through. I even have a website listed here. It's called Good Pill or Bad Pill, or what's that website called? I swear I have it listed here. Oh, I do not. But it is a website that does what the government does. Where they check the safety of drugs. I believe it's Good Pill, Bad Pill, or something like that. We'll have it posted in the comments below.
Mic off.
Every prediction that website has ever made of a drug they said the FDA would poll, they have polled, often years in advance of the FDA doing it, for the reasons they listed. And guess what? This is a non-profit organization that charges nothing for their insights on healthcare.
Yeah.
It's a free market institution that literally charges you nothing. Doesn't even charge the drug company anything that's doing a better job than the FDA.
Mic on.
I can't think of much else to talk about.
Well,
Timmy, do you have...
I do. I just want to kind of to wrap it up with something, just a thought. And that is that this isn't going to get better. I think it's important people understand the whole purpose of what they have done with the healthcare system to date is to push us into a single payer system where government completely controls healthcare, much like you have in the UK and Canada. Your thoughts?
Mic off.
Well, my thoughts have always been the same when it comes to these socialized
Mic
programs. If they were really as good as they said they are, they wouldn't have to break the numbers. They wouldn't have to make their alternatives look so bad in order to get what they wanted.
Mm-hmm.
It should be that if what they wanted was truly good for the people, they shouldn't have to do any of these things to make it look better. You know what I mean? Every time socialism fails, it's because that wasn't true socialism.
Mm-hmm.
Or every time communism fails, it wasn't true communism. You know how many millions of people have to die before people start looking at the facts and stop using their ideology to back what they believe?
Yep, especially when it comes to people's lives. When an ideology is literally, there, and the sacrificial lamb for it is literally the people that didn't believe in it in the first place and were forced into it.
Yeah.
This is something we all
Yep.
need to think about.
And while we wrap this up, I just do want to say this, that if you guys like this video, throw down some likes, because we also have a plan on a video we can do on how in this terrible system you can still get decent health care at a reasonable price. Not, completely affordable because of all these interventions, but you can still get something better than what we have.
Yep, so we can do a follow-up podcast, is what Conjecture's saying, with good news. I mean, there are some things you can do to reduce your healthcare costs. So, yep, just comment down below and let us know if you'd like a follow-up on this video. And then I think that's it. Unless, Craig, did you have any further thoughts you wanted to add? Possibly not. Okay, gotcha. Okay, I'll go ahead and wrap it up then, Conjecture, unless you have any other thoughts.
No, if I can think of anything, I'll write it down for the next episode.
Okay, gotcha. Well, I'll tell you what, gang. I want to say thank you, first of all, to Craig and to Conjecture for joining us for this podcast. This was actually kind of one that Conjecture and I have been talking about doing for quite some time, and I'm glad we were able to actually get this started. There's even more to this than what we discussed tonight, but we needed to cover some specifics on why the costs went up. We kind of want to take it in sections. And I would love to do more of these. So you guys let us know what you think in the comment section, as we had said, just a little bit ago. And thank you again for spending some time with us. We know that sometimes these podcasts can get lengthy. We hope they're valuable enough for you guys to continue listening to the very end. So we thank you, all of you. In fact, anyone who makes it to the end of this video, please put donkey ears in your comment section. I would really personally appreciate that. Okay, you guys all take care, and as always, may God bless each and every one of you and all of your families. Take care, gang.